Hi there, I'm Dr. Cecilia DiMartino, naturopathic doctor at Willow Wellness Clinic in Waterloo, Ontario. This is a six-part video series. This is part 5 of 6 on being pregnant and having a baby. So I'm going to be talking about this part is about prepping for the baby. So you're well pregnant and you're thinking about the next steps basically. So first of all, breastfeeding. So when you have your baby, whether it's vaginally or C-section or whatever it is, the first thing to do is to breastfeed the baby. The baby needs to eat somehow. And it's challenging. Breastfeeding is not easy. It's not as easy as it looks often, and you have to get the latch right. So this is an area that prepping for it, meaning maybe getting a doula, or maybe reaching out to what's called, in Kitchener-Waterloo, we have what's called breastfeeding buddies. This is totally free. These are, moms, volunteers that will gladly sort of sit down with you and help you with your breastfeeding needs. The La Leche League also very much around promoting breastfeeding and getting that to be successful, because it can be really frustrating. As a woman, most of us, I believe, would, prefer to breastfeed, but, if your milk supply doesn't come in properly, or the latch isn't right, or the baby's tongue-tied, or, that prevents you to, without pain, breastfeed comfortably and for the benefit of both mom and baby, if any little thing can go wrong and can really just, throw things off, and ultimately will have to, require formula. So ideally, if we can, it's cheaper also not to have to need formula, but ideally, if to have the best success around breastfeeding, there are also lactation consultants. These are all things that I would Google and at least get to know what's in your community, what's available, call people. How does it work in terms of getting that type of support? Because it's critical, right? As soon as the baby is born, the first week is critical in getting that right, or as right as you can. And some nurses in the hospitals are great, and others, I hear, are not so great, or not so supportive, or whatever. Unfortunately, Grand River Hospital, there's a lot of cuts that have happened, and their from what I understand, their breastfeeding support has been cut dramatically. So these are things you want to sort of prep ahead of time. So connecting and contacting other people is great. The other thing that you can do is go onto the Newman Breastfeeding Clinic website. So this is an OB in Canada, well known actually, and his specialty is breastfeeding and getting that initiated. What I like about his website is that he actually has videos. This is all free. Videos of what it looks like to have a good latch versus a not good latch, what to hear, what to listen for, what to look out for, what's the position of the head and the mouth. Not expecting you to become a lactation consultant and an expert just by watching the videos, but personally I did find it quite helpful, and even just as a basic understanding of what to do. So I definitely recommend watching those videos ahead of time, if you can. So, and then thinking about your hospital checklist, if you will, or even your home birth, in terms of what do you need, right? Will I need blankets? Will I need, obviously, a change of clothes? You got to have your baby stuff ready. You got to have the diapers, etc., etc. So just, think about that. Talk to your OB or midwife about that sort of stuff as well, to give you ideas. Talk to other moms so that you're ready to go. Have your bag ready to go, easy peasy. You're not stressing about it if something happens and you have to rush to the hospital. Have everything ready, or at least have a list, going, so that you know what to grab. The other thing is to think about is food prep. So, when you have a newborn baby, it's not really, top priority to be starting to, cook and make meals. You're going to be exhausted. So ideally you are pre-making a lot of meals. So if you can, make soups and stews and whatever the dishes that you want to make, and then just freeze them for when baby comes, that's going to be really, really helpful so that you can get good nourishment, but you don't have to spend a ton of time, cooking. If you can surround yourself with a support system. So if you've got parents that are helpful, if you have siblings, if you have good friends around, all of that is going to be helpful for you, whether they can maybe make some meals for you when baby comes, or clean up the house for you, or anything like that. For the first, 6 to 8 weeks, the first couple of months are they're hard. It's not easy. You don't always know what you're doing. You're gonna have your emotions are gonna run high. You're gonna be not sleeping through the night, and all of these things will get to you. So having as much of a support system that you can, somebody there for the first while that will spend the night with you. Hopefully your partner is supportive, or if you can get someone else in, that's always a good idea, so you don't sort of lose your mind, and decrease also the risk of postpartum depression as well. But always talk to your health practitioner if you're thinking that that's what's happening, to get the support that you need. What else? So other things to think about with regards to having a baby. And these are things that you can discuss, write down. Actually, I would write them down. Discuss with your OB or your midwife. Basically, these would be things that ideally you would happen. Of course, there are emergency situations that could happen, etc., where that would trump some of these wishes, and that's fine, of course. But if everything goes sort of, smoothly, some of the things to maybe ask for if this resonates with you. So the first one is the most common one. Most OBs, midwives, doctors know about this now, is the skin to skin. So that means when the baby is born, putting your baby against your skin. So you're basically sort of naked on naked, right? So skin to skin, that allows for better temperature regulation, blood sugar regulation. I mean, the research is huge with regard to the benefits, excuse me, of skin to skin for the baby. For sure. So that usually, unless they have to whisk the baby away, usually happens by default. But, always having that conversation to make sure that that is something that will happen, especially if that's something that you want. The other thing to consider is something is also delayed bathing. So that is also becoming a little bit more mainstream. Traditionally a baby is born and right away the baby is sort of washed, and they say that's not good, because you want that bacteria on the baby to stay on, longer. It's good for the flora. We're having a much larger understanding of the impact of the good microbiome, or the flora in the gut, in the digestive system, and the bacteria. And so if you can delay that first bath, and not to go crazy, you don't need to bathe your baby every day, right? This is your newborn, it's okay. It's not really dirty, right? So we think of, good bacteria. So think of it that way. But again, talk to your midwife or OB about that. The other thing to consider is, provided everything goes smoothly, of course, is delayed cord clamping. So traditionally, a baby is born, they basically clamp the umbilical cord, that is the blood supply to the baby. The umbilical cord gets cut. The baby is breathing on its own, right? However, what can be beneficial with sort of delayed cord clamping and cutting of the cord. So you basically would let the remainder of the blood circulate, going back into the baby, so that it just nourishes the baby. And ideally, if you can wait until the cord has stopped to pulsate, that's when you cut the cord. Again, unless I need to whisk the baby away urgently, if that is something you can do some more research on, but can be very beneficial. And then lastly, in the event of a C-section, so I mentioned the good microbiome, the good bacteria. Ideally your baby is born vaginally because it will go through the birth canal, and the bacteria that surrounds the vaginal walls of the mother will surround the baby and get inside the baby in the mouth, and will actually start to seed its own digestive system. And that is all very, very healthy, very good. Sounds gross, but very, very good. And if you're there's research to show that if your baby is born vaginally and has had this kind of sort of bacterial contact, vaginal flora contact, then they're less likely to get allergies, atopic dermatitis, or eczema. And so there's a lot of positives about a vaginal birth. However, in the event that we have to have a C-section, they've actually shown that if you mimic that vaginal birth, meaning that if you can insert a sterile a gauze that's in sterile water, like a tampon, basically. You insert that vaginally, and then when the baby comes out via C-section, you take that gauze and you basically wipe the baby with the flora, mimicking it passing through the vaginal canal. And the studies have shown that for babies that are born via C-section but have this seeding, if you will, versus babies that are born vaginally, have the same risk factors and outcome with regards to allergies and atopic dermatitis or eczema. So if you have the choice, that's a great thing to do. That's a newer thing. Not every midwife or even OB might know about it, but you can definitely Google that, and there are research studies to show that. And it's very safe. It's not, it's just a gauze that you then wipe the baby with. So it should be pretty simple, and in my opinion, should be routine in hospital settings, but is not yet the case. So these are some things to think about before you have your baby. Make sure you get consent with everything, meaning that when your OB or your midwife tells you there's certain interventions that have to be done, just make sure that they tell you and they don't just assume that you're going to go along with it, because you want to get the facts, the pros and cons, right? That's really important. So hopefully this information was helpful and that you enjoy my video series. Thanks.